What kind of injuries do napalm burns create? Imagine a weapon so fierce that it sticks to everything it touches, burning with an intensity that can destroy flesh and bone alike. That's what napalm does in warfare. Napalm is a sticky, flammable gel that clings to skin, clothing, and surfaces, causing immediate and severe burns. When it ignites, it melts flesh and destroys all layers of skin, often reaching underlying tissues. These injuries are deeper and more destructive than ordinary burns from fire. The burns caused by napalm are full-thickness burns, meaning they go through all layers of skin and sometimes damage muscles, tendons, and even bones. The pain from these burns is intense and can last for a long time. Because the gel is so sticky and hard to remove, attempts to wipe it off can spread the flames and make the injuries worse. Victims often suffer from second-degree burns, which damage the outer and underlying skin layers, causing blistering and extreme pain. Degree burns are even more serious, destroying all skin layers and possibly damaging muscles and bones. These burns may look charred or white and can sometimes be less painful initially because nerve endings are destroyed. But the long-term risks are high, including infection and permanent scarring. Clothing can be burned away completely by the heat, leaving victims exposed and vulnerable. In addition to burns, napalm explosions can cause other injuries. When dropped from aircraft, the blast can cause blunt trauma, penetrating wounds, and internal injuries like bleeding or lung damage. These injuries can be life-threatening and need immediate medical attention. If a person inhales hot gases or smoke from napalm, they can suffer airway burns, which cause swelling and blockages, making breathing difficult. Emergency responders must check for these injuries along with burns. The heat from a napalm explosion can also cause hyperthermia, dehydration, and even death from radiant heat alone, even if a person is not directly burned. Napalm also creates dangerous environmental conditions. As it burns, it consumes oxygen and releases toxic gases like carbon monoxide and carbon dioxide. Even people nearby who are not directly hit by flames can suffocate or lose consciousness from these gases. In enclosed spaces like bunkers or tunnels, the risk of suffocation is especially high. The intense heat can cause hyperthermia, dehydration, and death from radiant heat, even without direct contact with flames. During the Vietnam War, napalm was used extensively by both French and United States forces. Its ability to clear large areas, destroy vegetation, and reach enemies hiding in tunnels made it a powerful weapon. However, it also caused widespread suffering among civilians, including women and children. The injuries caused by napalm, deep burns, charred flesh, and long-lasting disfigurement became symbols of the war's brutality. These images were broadcast worldwide, showing the devastating human cost of this weapon. Medical treatment for napalm burns is very challenging. Immediate care involves smothering the flames, which is extremely painful. Patients often need pain management, infection control, and surgeries like skin grafts. Many survivors face lifelong scars and disabilities. The use of napalm in Vietnam left a lasting mark, reminding us how advanced weaponry can cause profound human suffering and shape public opinion about or and technology.